Today, we're discussing a troubling case that brings the complexities of healthcare insurance into sharp focus, the requirement for doctors to justify care during surgery, specifically in the context of treating breast cancer patients. Introduction to the issue. So, what's the situation? Recently, reports have emerged about UnitedHealthcare's policy that can force surgeons to justify their decisions about patient care during surgery. Imagine being in the operating room, moments away from performing a crucial procedure to treat breast cancer, and suddenly having to pause to verify whether the care you are about to provide is approved. This situation raises significant ethical questions about patient care and the role of insurance companies in making medical decisions. Today, we'll explore the implications of this policy, share the story of a patient deeply affected by it, and hear from healthcare professionals navigating this landscape. We'll also consider broader issues around insurance policies in the healthcare system and what this means for patients seeking care. A patient and #039's story. To put this policy into perspective, let's share the story of Sarah, a fictional name for a real patient, for anonymity, who faced this very dilemma. Sarah was a 45-year-old mother of two, diagnosed with stage 2 breast cancer. After weeks of consultations, she and her doctor agreed on a treatment plan that involved surgery to remove the tumor, followed by chemotherapy. On the day of the surgery, Sarah was nervous, but she trusted her surgical team completely. When the surgeon began the procedure, something unexpected happened. Halfway through, the surgeon received a call from UnitedHealthcare requiring immediate justification for a procedure that was critical to Sarah's care. The surgeon had to pause the operation to explain why they needed to perform a specific intervention, citing the necessity of immediate action to ensure Sarah's chance of recovery. This pause in Sarah's surgery not only delayed her treatment but also added an immense emotional burden on her, knowing there were bureaucratic hurdles even in life-threatening situations. The surgeon's perspective. Host, to understand the physician and #039's side, let's hear from Dr. Emily Richards, a breast surgeon who has experienced similar situations. Thank you for joining us, Dr. Richards. Can you describe your experience with insurance companies during crucial medical procedures? Dr. Richards, calm tone, thank you for having me. It's incredibly challenging. During surgery, every second counts. When I have to justify my decisions in real time, it creates a high-stress environment not just for me, but for the patients and their families. I and #039 had to pause surgery to answer questions that should have been resolved beforehand. It's not just about the bureaucracy, it's about the human lives at stake. That sounds incredibly stressful. What do you think drives these policies? Dr. Richards, insurance companies often prioritize cost management over patient care. They want to reduce unnecessary procedures, but that's a slippery slope. Medical decisions should be made based on clinical judgment and patient needs, not insurance protocols. The insurance company's response. Understandably, insurance companies argue that their policies are in place to manage costs and determine medical necessity. To gain insight into this perspective, we reached out to a representative from UnitedHealthcare but were unable to secure an interview. However, we can touch on common themes in their policies. These policies are designed to prevent overtreatment and to ensure that the interventions recommended by doctors align with evidence-based guidelines. However, they can also hinder timely patient care and lead to significant frustrations among both patients and healthcare providers.
To come together to push for policy changes that prioritize patient care over bureaucratic constraints. Organizations are lobbying for reforms that would limit insurance companies and #039 ability to interfere in urgent medical situations. Patients can participate by bringing awareness to these issues, advocating for themselves and others in the healthcare system. In closing, the case of UnitedHealthcare forcing a surgeon to justify care during a breast cancer surgery spotlights broader systemic issues in the healthcare industry. We must advocate for a system that prioritizes patient care above all else and holds insurance companies accountable for their role in patient health. To our listeners, we encourage you to stay informed, engage with healthcare advocacy groups, and speak out about your experiences. Let's work together for a healthcare system that serves the needs of patients, not just the bottom line.